This first module will discuss the common causes of injuries for healthcare workers and the effects of the injuries. First are some statistics on healthcare worker injuries. 2.7 million people die every year from work-related injuries. The healthcare industry is the leader in occupational-based injuries. Approximately 10 to 15% of patients are affected by incidents caused by a healthcare worker injury. Low back pain is the leading cause of years lived with disability and often contributes to early and involuntary retirement. And patient handling causes 31% to 72% of musculoskeletal injuries in a healthcare setting and 27% to 53% of workers' compensation costs. A study posted in the European Journal of Physiotherapy looked at the injury incident rate per profession in a hospital and found that, of the injuries reported, 39% came from nurses, 21% from nursing aides, 6% physicians, 3% administrative staff, 2% physical therapists, 1% occupational therapists, and 28% from individuals in various other departments. The most common injuries occur from patient handling tasks, from bed-based services to mobilization and transferring. Injuries also occur from repetitive motions like bending, lifting, and twisting when working with patients or equipment. Collected data on types of injuries that result in days from work in hospitals, with 63% being sprains and strains, 13% bruises, 12% from general soreness and pain, 6% fractures, 3% multiple trauma, and 3% other. Musculoskeletal injuries are most common, with injuries affecting the trunk, shoulder, arm, and hand at a rate of 11.2%, lower back at 8.4%, with nurses and nursing assistants reporting this most often, hip, knee, and ankle at 4.8%, and neck and head at 3.4%. It is also important to understand how these injuries affect you personally. Studies have shown that approximately 2/3 of healthcare workers that have experienced injuries at work express difficulties with memories, anxiety, anger, remorse, and distress. These difficulties often transition into daily life and hinder both professionally and personally. Injuries at work often lead to fear of injury reoccurrence through patient handling or similar actions to how the injury first occurred. This fear can then impact the patient and the healthcare provider. And lastly, injuries that require medical attention could result in days away from work or costly medical treatment.